नमस्कार, माझं नाव डॉक्टर रोशन कुमार पाटील. मी अशोका कॅन्सर सेंटर ऑफ अमेरिका दॅट इज अशोका CCA येथे लीड कन्सल्टंट रेडिएशन ऑन्कोलॉजिस्ट म्हणून कार्यरत आहे. Generally, diabetes is more commonly found in cancer patients. Diabetes is one of the risk factor for endometrial cancer or breast cancer or colon cancer. Sometimes the treatment of cancer or the use of steroids can aggravate the pre-existing diabetes. Uncontrolled sugar can definitely impact the treatment choice during the treatment, cancer treatment. So the controlled sugar or the controlled diabetes has to be there in order to get a proper cancer treatment. Comorbidities such as diabetes, hypertension, ischemic heart disease or hypothyroidism can definitely commonly found in cancer patients. If they are not controlled very well, they can affect our treatment. Sometimes they delay the treatment, sometimes they make the doctor to change their path of the treatment. So the patient will not receive the appropriate treatment because of these uncontrolled comorbidities. So it is very important to get medications and controlling these comorbidities during the cancer treatment.